The wrist area in the tennis player is talked about a lot at the professional level. However, in general, the wrist is not a major injury area in the recreational tennis player or even at the professional level. It's just when it does happen, a lot of people spend months and months away from the game, and we get a lot of poor technique issues, and that poor technique, if it's repeated day after day after day, can put significant strain on the wrist ligaments and the wrist tendons. But one of the big things with the wrist and how recovery can significantly help is to reduce that pain when the onset of it first occurs. And that's really something that's happening at the joint level, and being able to reduce the pain that an athlete feels is very, very important, because that's the first step in healing and the recovery standpoint. The wrist is talked about a lot in tennis players due to the racket and the ball interaction and some of the movements that occur on forehands, backhands, serves, and volleys. What we're going to do, we're going to start with our pads, and we're going to take our A frequency, so our 2 pads for A, and we're going to position one sort of just at the base of the elbow here. In this position, we're going to position our first pad there. Our second A pad is actually going to be at the palm of the hand. So it's going to be right in this position here. Then we're going to take our B pads and we're going to position one on this side of the wrist here. And then the second position is going to be palm facing down, and we're going to put it at the top of the wrist right there. So this really allows us to get a good cross currents between the wrist, and then with our A currents from here to the palm. Then we're going to set at low frequency on A, low frequency on B. Position our intensity around 4, see how the athlete responds. Position our B also on 4, and we're getting some good contraction there, allowing for good blood flow through the area. And we want to try to have the athlete work through this position somewhere between 30 to 45 minutes. Due to us focusing on the wrist, one area that we can work with the athlete on is making them a little bit more comfortable by utilizing a towel. By positioning a towel over their legs, they can position their arm and rest it in that position.